worried about this issue which has emerged just about 2.5, 3 months ago. And to discuss this, in most of the dimensions that we can, we have with us Dr. Davinder Gill. Dr. Davinder Gill is a vaccines and biotherapeutics expert. I am Vikas Dandekar. I write for ET Prime on pharmaceuticals and healthcare. Dr. Davinder Gill has wide experience in pharmaceuticals, and he's been last the CEO at Evolent Labs, which was a joint venture of Merck and Wellcome Trust in India. And that research project is about developing vaccines. So we have an absolutely rich knowledge coming from Dr. Davinder Gill. Welcome, Dr. Gill. I'll hand it over to you for all your perspectives. So basically, Dr. Gill will start with his presentation, which will take about 10 or 15 minutes, following which we will be expecting questions, and Dr. Gill can take those questions in written form, or maybe he can also choose to answer it live. So all yours, Dr. Gill, you can start.
Thank you, Vikas, and thank you for the opportunity. Hello, everyone, and thanks for joining. As Vikas said, I have a few slides that I'd like to share with you on this very important topic of coronavirus and where are we headed from here. So, as you all know, the situation right now is actually pretty grim. As of about a week ago, the WHO actually has announced this coronavirus epidemic to be a pandemic. As of March 15th, the most recent situation report suggests that there are now more than 150,000 cases, confirmed cases of coronavirus worldwide, 5,700 deaths. Those numbers actually have literally gone up in the last 2 or 3 days. Of course, this big epidemic began in China, where there are more than 80,000 confirmed cases and a large number of deaths in China as well. But what's interesting is that in the last few weeks, the number of cases outside China is actually now starting to increase very rapidly. There's more than 72,000 confirmed cases outside of China. And the number of countries that are reporting at least one confirmed case of coronavirus is also going up, and it's currently at 143. So the question really arises, how does a virus attack our immune system? Now, the coronavirus is one that actually affects our respiratory system. So I'll use the flu virus as an example because these viruses actually act similarly, although there are some differences. So essentially, a virus such as a flu virus or coronavirus enters our respiratory system. It binds to the surface of cells. The virus then opens up and releases its genetic information, such as the RNA, into the cell's nucleus. The virus replicates, it takes over the cells, and copies of the virus then move to the cell membrane until the cell finally dies and releases the virus outside the body, where they go and infect other cells. The key difference between coronavirus and influenza, is that coronavirus is actually a lower respiratory virus. And that has some important implications in terms of its transmission, which we will talk about in a second. Now, what's interesting also about coronavirus is it's not an equal opportunity killer. So what we mean by that is that if you look at China, where we've had 87% of cases, and 87% of these cases actually have been in people between the ages of 30 and 79. And only less than 10% of the cases have been in 20-somethings, literally 1%, 1.2% in teens, and very small, less than 1% in children less than 9 or younger. And this finding actually has been confirmed by the WHO mission to China, which also found that almost 80% of the cases were actually in the elderly. So this virus, COVID-19, that we call coronavirus, is disproportionately affecting the elderly people. That also has some implications, although I should say that there have been anecdotal reports that even younger people actually are now beginning to succumb to the effects of this virus. The other important aspect is that based on the limited data that we have, the coronavirus seems less deadly but more transmissible than SARS or MERS that we've seen before. So for example, compared to the SARS and the MERS epidemic that we've previously seen, the case fatality rate, which is simply the number of people that die divided by the number of people that are infected by any of these infections. So the CFR for SARS was 9.6%. For MERS, the CFR was very high, 34.4%. But with the data that we have right now, the COVID-19 CFR is 2.3, which means of 100 confirmed cases of COVID-19, 2.3 people have died. So the overall mortality seems to be lower, but the transmission is higher, as we've seen through this very rapid outbreak of coronavirus. The other important aspect is that unlike SARS and MERS, the hospital-based outbreaks do not seem to be a hallmark of COVID-19 at present. This is largely a community-based outbreak, and that's the reason why governments and various institutions are taking such severe measures to essentially control the community and the spread of this disease. Now, of course, we've had a number of epidemics over the last century, and you can see that here. What's important is the unique thing about COVID-19, which is that this is an epidemic that seems to be spread through people that are asymptomatic. We'll talk about that in a second. So you can see back in the 1900s, in 1918, 1919, we had something called the Spanish flu, which has frankly been one of the largest epidemics, almost 250 to 700 million people that got affected, somewhere between 20 to 50 million people died. So a very, very large casualty in the society. And then over the years, we've seen various epidemics, the Asian flu, the Hong Kong flu, and so on. But the ones in recent memory, the two big ones have been the SARS from 2002, 2003, and then the MERS, the Middle East Respiratory Syndrome from 2012 onwards. And most recently, before coronavirus, we have also seen Ebola a few years ago. So you see that these epidemics are actually, they're periodic, they come, they're unexpected. And surely as we enter 2020, no one actually expected something like COVID-19 to become such a huge global crisis. Now, a number of companies are working on coronavirus treatments or vaccines. At last count, there were at least 10 companies that were working, and you can see those here. Important to say that out of these companies, there are a couple that are in the lead that are worth mentioning. One is a drug, remdesivir, from Gilead Sciences. This is a drug that was being developed for treatment against Ebola infections. And it seems like this drug might have some implications for coronavirus, and it's currently in phase 3 clinical trials. In terms of vaccines, the vaccine that's most advanced in some respects, but still very early, is the one that is jointly being developed by a Cambridge biotech called Moderna, in collaboration with the National Institutes of Health in the United States, called mRNA-1273. This vaccine has just started phase 3 clinical trials. As a matter of fact, the first patient got dosed yesterday in Seattle with this vaccine. So things have kicked off, but all in all, things are still at a fairly early stage in terms of either drug or vaccine development, although a large number of companies are actually working on this important initiative. Now, what's important also is to recognize the challenges of developing coronavirus vaccine at short notice. Of course, this whole epidemic only arose about 3 months ago. COVID-19, which is a member of the coronavirus family, is it's a novel coronavirus. It's never been seen before. And so therefore, the amount of information we have available against this vaccine, against this virus, is actually very limited. And so therefore, to make a vaccine, there are obviously many steps. One has to decide what type of vaccine one wants to make, whether it's a DNA vaccine, an RNA vaccine, a spike protein. The Moderna and some of the other companies that are working on RNA technology one has to recognize that that technology in itself is actually an unproven approach. There's no approved vaccine based on that technology, so you can understand the risk. Then, of course, once you have the construct in hand, there's various animal testing that is required, and only when the vaccine is proved safe in animals, one can move into human clinical trials. And even in the human clinical trials, you have to first demonstrate safety and then move to establish efficacy. And that's precisely what is being done with some of the vaccine candidates that have just started testing. So you can see how this overall approach from gathering information to designing a construct to the animal testing to human clinical trials actually takes time. And this is the reason why I certainly don't expect a successful vaccine to be available quickly. This will take time and it will be challenging. In addition to the vaccine effort, of course, this virus has caused major impact on global economy. By some estimates, there's almost $2.7 trillion worth of impact that has already been made by this epidemic, and that number is likely to increase as we go forward. You can see that the world output in terms of GDP is already predicted to dip by 0.5% from 2.9 to 2.4. And in various OECD countries, you can see that there is going to be an impact in terms of 2020 forecast in terms of GDP growth. In places like China, auto industries, auto sales have plummeted, as we all know, because of the travel restrictions. Travel has actually reduced. And in many ways, because of the quarantine and the restrictions imposed by the governments across the world, the economy, as we know it, has practically ground to a halt. And that's going to have some very, very significant impact as we go forward. So with that, I'd like to thank you for joining us and open it up for questions.
Right. Thanks, Dr. Gill. That was quite exhaustive. We covered the disease, the pandemics that we have seen in the last century, and the broader economic fallout of such a viral outbreak. As we are actually seeing, the questions is still not queued up. May I start with something that, okay, we have seen one question, you can take it forward. What about the spread in India?
In India, this is also a very rapidly increasing problem. As we've seen, there have been cases around the country, there have been deaths, and there's no question that there is a huge risk in India. Now, the government, of course, has come together very quickly in terms of distributing information, making various restrictions on movements, on quarantines. We've heard about quarantines. And importantly, India as a country has actually quarantined itself from the rest of the world. So no travel is actually being permitted except for essential travel. So the country is taking a number of steps only because the risk is very high within India.
Sure. There has been a lot of, chaos regarding the masks, and as a question comes from Ajinkya Jadhav, he's asking whether it's all really of any utility to have masks.
In my opinion, I think masks have limited utility. And I think the reason for that is that obviously these masks have to be the proper grade in order to be able to block the virus. Not every mask can actually do the job. Masks themselves are not 100% if they're not used properly, if not fitted properly. They can have limited impact. And I think the most important thing here is to actually avoid it's the social distancing, it's the physical contact, and I think that's more effective. Things like hand washing, for instance, or simple hygiene and maintaining social distance, I think are far more effective than the use of masks.
Sure. A question from my side. Right now we are seeing a couple of, some exciting research initiatives. One block is about repurposed drugs, where we have seen, Takeda talking about its plasma technology. Pfizer is trying to open up its own pipeline of drugs where they can see some repurposing if it is possible. And then there is another side which is about vaccines, which you have described. And then there are people who are also talking about monoclonal antibodies. Which of these three sets do you think will really go ahead? Because, as it has been observed, the moment the outbreak actually starts flattening, or as you say, bending the curve, everything, stops. And then we come back to the same thing when there is another outbreak.
Yeah, I think because it's a very good question, but also a very difficult question to answer, largely because, as I said, this is a new virus. It's a novel coronavirus. There's very little we actually know about it. So with the limited amount of information and the fact that the world has actually never seen a virus like this before, it's a little difficult to predict as to what approaches will work. But I think if I were to hazard a guess, I would say that some of the drugs, the antiviral drugs that are being tested, I gave the example of the Gilead drug. If we're lucky, if any one of these drugs, existing drugs, repurposed drugs, has any kind of an efficacy, then I think what I envision is probably maybe a two-step or a two-phase approach to addressing this virus. Maybe in the early onset, it could be these repurposed drugs or these existing antivirals that provide some relief against spread transmission of this virus. But in the long run, it could be a very potent vaccine that actually becomes the public health intervention of choice. So it could actually be some kind of a two-phase approach. But as I said, that's a very, very deep speculation, only because there's very little we know about this virus.
Sure. You are in the US and you've studied how situations have actually panned in Italy and then Spain. We are now seeing an excessive, spread. In the last couple of days, it's actually moved beyond 100. Do you think the preventive measures that are being taken right now will be of much use, or do you think we will see a kind of a community spread because there are such, glaring red lights that we have seen?
I think without a doubt, the measures that are being taken by various governments, I think, are going to be effective. Because remember, as I said, this is a lower respiratory virus. It is spread through coughing, sneezing, through droplets in the air, and so on. So I think to the extent that governments can take measures to make sure that people don't assemble in large areas and groups and so on and so forth, and these quarantines are going to be effective. Now, China is a great example, because what's interesting is that this epidemic, of course, began in Wuhan, grew exponentially in China. But the kinds of measures that were taken in China, what's interesting is that now we're seeing a flattening of the cases in China, whereas we're seeing a rise in other countries. And if you also look at the example of Singapore, for instance, the very, very strong measures that a country like Singapore took in terms of not only tracing the infected patients, quarantine, but also imposing very strict restrictions. I think all of those things have helped. So in my view, I think these measures actually are going to be helpful. Whether they are 100% effective, I'm not exactly sure, because it's actually at a global level, when you're talking about 140 countries, to restrict the movements of people indefinitely is a very, very difficult thing to do. I think for a short-term measure, it may be okay. So I think that while these measures are critical, it remains to be seen whether in the long run, whether it's the only thing that will be required, or whether additional measures will be necessary.
Sure. Another important question is on, there is a lot of scare regarding travel. And one of the questions I've actually asked, is it safe to travel intracity to your friends? Basically, it's a question on the infectivity of the virus. Do you think like it's highly recommended not to travel at all? Or do you think with safeguards, we can still do some intracity travel?
I think my view would be that given the uncertainty, given what we don't know about this virus, we don't know who the carriers are, who the super carriers are. My view would be that when it comes to travel, I mean, do it only if you think it's absolutely essential. If you feel you cannot really do without it, and do it with precautions. Take the necessary precaution, wash your hands, maintain your distance, and those kinds of things. But I think in this type of under times of uncertainty, when there's so little we know, the safe thing would be to not travel unless it's absolutely necessary.
Right, right. Perfect. One question, Dr. Gill, is on the quarantine period. I mean, is it 14 days or is it 27 days? Because in China, it was seen that people who were quarantined and then they were moved out of the quarantine period. After 27 days, also they came back with the infection.
Yeah, so I think there's been some debate about this question, and I think that at least certainly the experts that I have heard have said that the average incubation time for this virus is about 2 days. The spread is from about 4 days. I'm sorry. So the spread is between 2 days and 7 days, with a median of about 4 days. So I think the experts that certainly I have interacted with suggest that a 2-week quarantine actually is going to be sufficient. Now, as in any virus, as in humans, with the variability that we have, I think there's going to be outliers. So I think what's important is to make a distinction between the quarantine that's going to be necessary for the majority of the people, which I think most experts agree 2 weeks is sufficient. And then I think you're going to have some occasional outliers. Where perhaps even after 14 days, there's some viral shedding.
Right. Dr. Gill, some serious patients were also seen from the younger age group between 20 and 40. Is there a kind of a confusion on whether it really affects only the older age group? We've seen that data which comes to mind always, about 80% will be safe, and it will be only in the mild symptom stage and it will go away. Is that also coming in some question now?
I think it is. I think that, again, this whole idea about this virus disproportionately affecting the elderly is based on the Chinese data. And there, what we saw is that out of the 80,000 odd cases, almost 70-80% actually were in the older age group. And almost 70,000 of the patients who were infected by the virus actually successfully recovered. So I think as this infection spreads, as we're gathering more data and in more diverse populations, not just in Chinese population, but perhaps in South Korea and in Iran and Italy, in Japan and the rest of the world, I think this is where we're actually now finding more information about what are some of the other age demographics that this virus affects. And as you rightly pointed out, that in recent weeks, we have seen some incidents where even younger people have developed some severe symptoms. So we are seeing people in their 30s and 40s. So it is definitely something that's emerging. And I think with more information, we'll have a better idea.
Right. One question, Dr. Gill, is on the protease inhibitors that we've seen. Apart from remdesivir, people are also trying out some other, combinations like lopinavir and ritonavir, and then there was also talk about combining oseltamivir. These HIV drugs and then Ebola's, what remdesivir was for, basically. There was a set of trial which actually Stat News reported. It didn't do too well in very small subset of patients, though we are actually expecting in April and first week of May the wider results of the China trials. Do you think there is some mismatch in expectations on such protease inhibitors, or do you think as you rightly pointed out, the chloroquines, and then there was another report which mentioned about DPP-4 coming in some active play? Do you think those will look like more possible, because you still need to be very sure about your trial results?
Yeah, no, I think you're absolutely right. I think that at the moment, I think that what various researchers are doing is looking at the virus, looking at its mechanism of infection, mechanism of entry into cells and integration into the cell, and using existing drugs based on those kinds of hypotheses. And that's the reason why we've seen the various anti-malarial, anti-HIV, and antiviral drugs that are being tested. But I think the precise mechanism of this particular virus, of course, remains unknown. So I think that if anything, it could be serendipity that one of these existing drugs might prove to be somewhat efficacious. And that's the reason why I feel that we might be looking at some kind of a two-step or a two-phase type of a solution to this problem, maybe in the early onset or the early stage, some kind of an antiviral approach, but in the long run, some kind of a prophylactic approach, like a vaccine.
Right. Two very controversial issues also sprung up in the last couple of days. One was of the U.S. government looking at approaching CureVac for their vaccines for exclusive supplies, and the other one was Dr. Patrick Valiance, former GSK R&D head, talking about herd immunity. Do you think both these two steps, in terms of the ethical viewpoint, where do you think these will take us?
Well, the first one, of course, because it's extremely controversial, as you have already heard, that the German government has actually stepped in and said that the research being done by CureVac in Germany is not for sale. And I think that this kind of a thing is unprecedented, where there's a global epidemic, there's a company working on some innovative approach, then some nation approaches them for exclusive rights to that vaccine or that drug. So I don't think that this actually is going to be feasible, and I don't think that this is something that will ever be entertained either by the German government or frankly by the international community. There's a lot of ethical issues in this, not to mention those. Now, as far as what's happening in the UK, now, as you rightly said, Sir Patrick Vallance has actually talked about a very contrarian approach. If you look at what UK is doing as opposed to other European nations like France and Italy, it's doing two things. One is that they are taking an approach where they feel that the epidemic is already here. So instead of trying to control the epidemic, they're trying to delay it. And the way they'd like to do that is by not restricting the movements and quarantine and so on and so forth, but by allowing people to actually be gently exposed to the virus and gain natural immunity. And Sir Patrick's thought process behind this, from what I have seen, is the simple notion that if you quarantine people, people are still going to socialize. So instead of spreading it to the wider community, they're actually going to spread it within their family. So kids might give it to the grandparents and so on and so forth. So I think it's a little bit controversial. It's definitely contrarian. Whether this approach actually works, I'm not quite sure. What we have seen from the UK in recent days is a little bit of a backstep, where I think the Prime Minister has now said that the UK will also follow the kind of restrictions and quarantines that some of the other European nations are following. So I think this is, again, let's not forget that governments and institutions and experts are actually operating in an environment of very limited information. It's very difficult to actually say what is right, what is wrong. But definitely, I would say that what the UK has done is actually quite unorthodox in terms of their approach.
Right. From all the control measures that we've actually seen so far, I think Korea has done the best, right, in terms of testing. But from what we see, it's pretty contrasting in India. It's been a lot of hesitation whether private labs can be allowed to do the tests and whether they can release those test kits. And then they have kept the criteria for inclusion for tests very narrow. I mean, you can only test when you have come in contact with a person who's traveled from the affected countries, or, there's some kind of a connection that you can actually draw that some person may have been affected by COVID-19. What do you think will be the best approach for a country like India?
I think India, frankly, has no choice. I think if you look at how other countries, you mentioned Korea, Singapore is another example. I think that the way these countries actually have managed the epidemic is through a very, very detailed, almost a forensic level of tracing and follow-up and tests, and then followed by quarantine. And that's the only way in which these countries have managed to arrest the spread of this epidemic. I think India has no choice. I think some of the measures that India has taken are, of course, admirable. But I think in terms of this testing, and particularly, I think narrowing the scope of the testing, I think is a very risky thing to do. Let's not forget that this is a virus that can be shed even by asymptomatics. There's an incubation period where you don't develop symptoms. So I think to only allow the test for people who are coming from high-risk countries, etc., I think is very risky. I think at a minimum, what India needs to do is recognizing the risk, actually increase the use and the implementation of these tests. I think that's what will allow them to identify hotspots. It'll allow them to identify clusters. And once those hotspots and clusters identified, then and only then some of the quarantine measures become effective. So I think for India, it's important to actually draw some lessons from other countries and see what's worked for them.
Right. One important question, I think I'll have to rephrase it, is from Rishabh Somani. He's asking, can the virus affect a person once once he has been quarantined for 2 weeks? So is it like, do we still have a possibility of a second peak, which sometimes people dreadfully say that it could be even more fatal than the first wave?
Yeah, so yeah, we have not seen that. So in principle, yes, that's entirely possible. I think that this whole notion of, could you have a second wave or a third wave of coronavirus infections is being debated. And I think a lot of people, and this opinion is split. Some experts think that it's unlikely. With other members of coronavirus, for example, SARS and MERS, we saw the big peaks when these epidemics broke out, but we did not see subsequent waves. This is a new member of the coronavirus family, and it's entirely possible. Once again, I think if you look at China, I think China is probably going to be the bellwether for us in this case, because as we watch what's happening in China, and if we actually see a second wave or a third wave, I think there'll be reasons to believe that this could happen with coronavirus. But thus far, we're not seeing that.
Sure. Another question, again pertaining to the tests that we have been doing here. With the population of our size, maybe Korea can actually have the resources to do that, and they've converted their telephone booths into sample collection centers, and they have those resources and the ability to actually press in their technology, where they actually, as you rightly pointed out about the forensic level, contact tracing. In a constrained situation like India, what could be the solution if it is not mass testing?
I think that's a very, very difficult question. I think that the testing piece of it really is a critical component. I think in my view, I think rather than adopt a choice of do you mass test or do you not, I think the tack that India could take is that India has a base for low cost pharma manufactured drugs, diagnostics, and so on. I think we've seen in the United States, for example, this vaccine that we talked about a minute ago. In less than 70 days from the time that the virus was actually sequenced, the first patient was dosed with a vaccine candidate. The speed with which the country actually operated is unprecedented. I think that's again a lesson that India could take. So instead of making a choice, do you do mass testing or not? I think the question would be, we have numerous low-cost centers, we have academic labs, we have a very good manufacturing base, and so can we actually quickly across the country tap into some of these low-cost solutions and try to get the cost and therefore the supply of these tests as quickly as possible. I think that would be maybe an important strategic decision for the government to take. I think in the event that is not possible, then I think that these other measures in terms of tracing symptomatic patients, treating the most critical ones, and really very, very strict quarantine and control is going to be necessary. Other than that, I really don't think there's any other way to arrest the spread of this disease.
Right. Basically, from the swine flu example, we did like about 2009 and 10 when we saw the test prices of around 5,500 rupees. Why do you think the testing, industry has remained very localized to Europe and US. I think some Japanese companies do that, but is it such a difficult process that we cannot have a lower cost alternative to test so that the price itself becomes lower, and then you can actually easily do mass tests?
I think the answer to that question really lies in both the inherent technology that is being used, but also in terms of how widely these tests are actually being. So in the case of the swine flu, of course, there was a spike and then it quickly went away. And I think for kit manufacturers, the incentive to actually scale up, reduce the cost, and perhaps bring in some low cost innovations, that incentive was not there. Now for coronavirus, of course, it's very different because this is now a global problem. These tests are going to be used globally. So I think there are strong incentives in the case of coronavirus, both to bring in low cost innovations, but also to scale up. And definitely we're seeing a lot of companies step in, even to look into innovative low cost testing kits.
Right. One question, Dr. Gill, comes to mind always, and people have been dismissive about it, but there have been some reports which have also come in, research reports in reputed research publications like Elsevier. Do you think summer or heat probably will take care of the virus? Because we're approaching summer, so
great question. I think that's frankly the $1 million question. I think that certainly I think that every government, every country hopes that as the northern hemisphere moves into summer, that the spread and the increase in coronavirus cases actually begins to decline. I think what is perhaps a little disheartening is that if you look at countries that are actually operating in tropical temperatures, if you look at, for instance, the Middle East, if you look at Qatar, if you look at Indonesia, if you look at Iran for that matter, or some of the other countries, even in the United States, if you look at some of the southern states like Florida, where temperatures actually are already fairly mild, 27, 28, 30 degrees Celsius, we're seeing the opposite. We're seeing a handful of cases actually spiraling into what looks like a full-blown epidemic. So I think this question that you asked, Vikas, is actually the $1 million question, whether with the advent of summer in the Northern Hemisphere, are we going to see a decline? It's a very difficult question. My own, if I were to hazard a guess, I don't think that we are going to see a complete disappearance of this virus. I think there might be some slow decline, but I think based on what we're seeing in some of these tropical countries, I think it might be a gradual tapering off as we move towards the end of 2020, as opposed to a very sudden decline as we approach summer in the Northern Hemisphere.
All right, okay. Another related one is about a question, is thermal screening actually impactful, which is deployed outside offices and malls currently? Will it filter out 100% of infected people?
No, I mean, the short answer is no, it will not filter out 100% for various reasons. Thermal screening is, of course, the most basic tool that one can use. And I think it's an important tool because one of the key symptoms of the coronavirus infection is fever. So I think if you can trace that, then that itself is a very important step. But of course, you can get fever because of various other reasons as well. Fever is a very, very common symptom in people. But in addition to that, as I said, that with coronavirus, what we're seeing is you can actually have the virus and be asymptomatic. There's an incubation period where you have no symptoms. And so in thermal screening, you might actually prove to be non-symptomatic and still be a carrier. So in my view, I think thermal screening is a basic, important, a very simple step that can be taken in communities. It is not 100% foolproof.
Right. We have Google launching its COVID diagnostics toolkit in US. How soon can it be launched in Europe and Asia? And what's your take on that launch itself? Do you think it will be successful?
I think it remains to be seen. I think that any kind of AI technology, I think that can help in terms of the diagnostics, I think is helpful. I think that there will be some kind of a testing, some kind of an experimentation, or some kind of familiarity with this test that will be gained in Europe. I anticipate that if the early signs of this Google test is successful in the US, then I think the spread of this to Europe and other countries will be pretty rapid. I think this is actually very different from the classical diagnostic and kits that many other companies are developing. So I think if this is successful, this could actually spread and be available much more quickly.
Right. Um, you know, in India, Dr. Gill, we have now started talking about involving private labs, and till now the approach was that we need to have a very clear safety rules in place so that we don't have a outbreak because of one person spreading the whole hospital with a virus. So with visits to the doctors or hospitals, do you think we actually have amplified the risks of a spread in case a person has to travel to the private lab for getting a test done?
No, I don't think so. I think that I think if you look at, for instance, an infected patient going to a private hospital, I mean, the private hospital in itself, as compared to a community, which is a very large setting, the private hospital on the one hand is a smaller setting. The second is that it's a hospital setting, and so therefore, I think the risks of actually spreading within the hospital is there, but I think it's relatively small compared to the spread in the community. And finally, it's in a hospital setting, so there's a lot of measures that can be put in place both by the caregiver as well as measures that can be imposed on the patient in order to minimize the spread. So I think if I weigh and balance the benefit of bringing in people and getting them tested versus the risk of actually having patients within the hospital infected by this virus, then I think the benefit to me outweighs the risk. I think it's the spread in the community, the broader community, which I think is far riskier.
Right. On the tests, Dr. Gill, do you think we need to have more tests than one? Because, even in India, the way it goes that the sample collection center does not have the right to declare whether the patient has got a positive result. It has to be validated with a confirmatory test by National Institute of Virology in Pune. So do you think there are variations in the results, something that is false positive or false negative?
It's difficult. I think it's difficult for me to answer that question, but I think that I think what's important actually is again drawing a lesson from China, because in the early weeks of the outbreak in January of this year, for instance, and then moving into February and into March, there was a slight change in the tests and the way the Chinese were actually diagnosing patients, and that caused a lot of confusion. You know that in the United States, that the test which has been approved by the WHO is actually was not used or was not recommended by the CDC, which led to a big delay and a big problem in the United States. I think this is again a lesson that India can learn. So I think while there's always going to be that difference between the false positives and the early diagnosis versus the late diagnosis, but I think what India cannot risk to do is to start moving beyond these standard tests, these approved tests that have been approved by the WHO and by the global community. That I think will be very risky and it will cause a lot of confusion. So I think it's important to stick to the established tests and to do those as rigorously as possible.
Right. Typically, Dr. Gill, we've seen this outbreak for the last 3 months now, December, Jan, Feb, March going. How much time do you think it takes for a virus to really go away? Because we don't have pandemics can be for a very long time, but does it really flatten out and become something like a flu? Because, that theory has also been floated.
That again, because it's a very difficult question to answer, because there's so little we know about this virus. In some ways, I think you would argue that viruses in many ways actually never go away. They always lurk around. But I think if we look at what we can draw from other coronavirus infections, particularly SARS and MERS that we've seen in the last decade or so, then you're right. We saw a spike, we saw a peak, and then we saw a decline, and we saw more or less that happening within a 1 year time period, plus or minus. So I think if we hope for the best and we're optimistic, then I think that we can perhaps predict that for coronavirus, as you said, that it really began in the beginning of 2020. We're literally at the early stages. So I think it's conceivable that it might peak sometime in the middle of the year. And then again, with an optimistic scenario, by the end of this year, we could see a decline. But there's so many unknowns in that because there's so much we don't know about this virus.
Right. Is there some kind of a immunity threshold, Dr. Gill? Why is it like, most of the older patients are getting affected? I mean, we've heard about the comorbidities and so on, but is there an immunity threshold which people have been talking? I mean, if you have a strong immunity, you will not get the virus.
Well, I think that's certainly true, and I think if you look at the elderly population, then I think that the susceptibility of the elderly population is high, not just to coronavirus. Elderly people disproportionately die because of flu. They disproportionately die because of pneumonia, pneumococcal infections, and so on and so forth. So I think that has to do with more with the immune senescence, that as you get older, your immune system actually weakens, and so that's actually broadly true, and we're seeing that for coronavirus. So I think that with younger people, where you have strong immunity, then your ability to fight things like coronavirus, flu, or other respiratory infections is actually stronger. So there's definitely a correlation. But in terms of a serological immune threshold, we simply don't know whether a certain level of, let's say, antibody titers in the circulating antibodies are going to be protective. I think some of these vaccine trials that are being done might lead to some of that data, but that information in terms of threshold is not yet available.
Right. Italy seems to have actually, got the spread pretty fast, and the casualties have also been quite alarming. Just a couple of days ago, we saw 368 deaths in a single day. What probably could have gone wrong? I mean, they didn't do the lockdowns in time. Do you think the virulence of the whole thing actually goes up? What could have been the reason?
I think the reasons, it's difficult to speculate, but I think the reasons could have been several. I think that on the one hand, I think, as you said, there was a little bit of delay in terms of putting in some of these measures in social distancing and quarantine and so on and so forth. I think the other thing about Italy is that you have these very dense urban clusters in various cities, and that's frankly where we're seeing some large number of cases in the capital city and in other urban areas. I think the other possibility, as we've seen in Korea, there is the possibility that Italy may have been victims of super spreaders. Now, we know in Korea, through some very excellent tracing that the Korean government has done, the so-called patient 31, for instance, in Korea, that actually was responsible for a very dramatic and a very sudden and a very large spike in the number of cases. I think it's entirely possible that Italy may also have had a few super spreaders that might have caused this very devastating spread. So it could be a combination of those reasons.
Perfect. Dr. Gill, most of the people have been advised to work from home, and a lot of societies have actually built in their safeguards. Do you think, the vulnerability at home also increases even with these safeguards? Do you think, the virus really settles on surfaces of different material? What do you think about that? Do you think it becomes even more dangerous?
I don't think so. I think that obviously, I think that, given that you have a lower respiratory infection that spreads through cough, sneezing, and so on and so forth, I think that if people restrict themselves from homes, obviously their ability to spread the virus is limited. In terms of the virus on surfaces and so on and so forth, of course, coronavirus, like any other virus, can survive on a surface for a little bit of time. But then again, I think that if you are actually restricting yourself at home, your ability to use proper hygiene is much better than when you're traveling or when you're out and about. For instance, your ability to wash your hands very frequently, your ability to wipe surfaces every so often. That ability is much higher when you're at home as opposed to when you are in public places or when you're traveling or you're at work. So I think that the risks actually are much, much lower if people self-quarantine or if people work from home.
Right. I'd like to take you back on your core vaccine research, sir. So within the vaccine research, we are seeing the messenger RNA, the Moderna thing that you mentioned. Then there is this CuraVac also, and then the conventional way of doing attenuated vaccine technology, and then there is a Serum Institute, collaboration with Codagenics, which will be working on algorithms, so that the vaccine development becomes faster. In terms of the practicality, Moderna didn't do their clinical trial, the animal studies also. It's gone directly into humans. So in these, because we have always seen that the vaccine development actually somewhere crashes the moment the outbreak really becomes milder. Do you think it will be in time and then it can actually lead to a universal vaccine where we don't have to wait for another outbreak, and one vaccine probably will be suitable for across pandemics?
I don't think so. I think that's a very, very difficult aspiration to hold. I think that I think we're lucky if we end up having a safe and an effective vaccine against coronavirus. Remember, for Ebola, as soon as the epidemic arose, there was a push by various companies, including large pharma companies, to develop effective vaccines, and it still took 3 to 4 years. And a very similar setting where people went straight from the lab into human clinical trials, and in fact, the clinical trials were actually done within outbreaks because that's how it was. So I think that in these kinds of settings, I think what we will see is this kind of unprecedented urgency and speed to move vaccines into development in the right setting, in the right resource setting. But I think what is very difficult to conceive is, along with this speed, we would end up with some kind of a universal vaccine that will work for everything. I think, in my opinion, that's an extremely tall order that I don't think is going to be possible.
Right. Dr. Gill, what do you think about, and this is a little controversial, so, answer the way you would want to, on the bioweapons theory. I mean, that's been propping up on and off. Do you think there are these vaccine, defense capabilities? Because Israeli scientists and defense experts have been talking about these possibilities that China might have done.
Again, because there's a lot of speculation out there in terms of what might have gone wrong in Wuhan with respect to some of the defense experimentation by the Chinese. In fact, some Chinese diplomats have, in fact, even accused the U.S. Army and have made accusations that it was the U.S. Army that actually brought in this virus into China. So there's all kinds of speculations out there. So I think what I will say is that purely from a technical point of view, I think what has long been known, not just with this coronavirus outbreak, but previously when we had anthrax and some of the other outbreaks, what we have known is that this kind of viral technology, if it gets into the wrong hands, can easily be misused for bioterrorism or for germ warfare and so on and so forth. So that has been known in the global scientific community for a long time, and that's been the reason why scientists have actually urged governments to take these things very, very seriously. So I think the potential is there. The question of whether something like that might have actually happened with the coronavirus, I think is completely speculative, and I think it's very difficult to say whether it may or may not have happened.
Right. A question that actually has been in my mind for a long time, and that was one of the stories that ET Prime actually attempted. was about the slow interest and the discouraging facts about vaccine development. How do you think things can get better? Because these are the times when you actually think that vaccines could have done such a big role. But every time we see this go, the levels of interest actually goes down.
Yeah, I think you're absolutely right. I think that I think that this coronavirus experience, I think, is teaching us a couple of important lessons. I think the biggest lesson that it's teaching us is about preparedness. And I think experts have long actually argued that the next big pandemic outbreak is just around the corner. And we as a world actually need to be prepared because these viruses don't respect borders, they don't respect territories or nations and so on and so forth. So I think the first big lesson that this teaches us is how, as a global community, we need to be better prepared against these pandemics. I think the other important lesson is that if you really look at what is social distancing and what is quarantine and what is all this really doing, in a way, it's basically protecting individuals and therefore protecting the broader community. And then if you draw a lesson from that in terms of what do vaccines really do, you vaccinate yourself, your children, so that by protecting them, you're protecting the broader community. So I think that the other important lesson, hopefully, that will come out of this is that this big rise that we've seen globally, vaccine hesitancy, will now flip. Well, people actually now have experienced, they have now seen the devastation that an epidemic and a virus can make. And so therefore, perhaps the embrace towards vaccines will be higher. And then thirdly, as you said, this will also be a wake-up call to the scientific research community, the vaccine development community, that this is an area that frankly cannot be ignored, and important resources and development have to be focused in this area. So I think those are a number of lessons that actually can be learned from the current experience.
Right. So 5 countries, Dr. Gill, became like, I mean, they claim they have isolated the virus, which will probably help them in making the diagnostic kits and then probably, also help them develop some vaccines. Do you think this really paves the way for some kind of a concerted effort?
Well, I certainly hope so. I think that one of the very satisfying things and the hallmarks about this kind of a concerted effort is that from the time that the novel coronavirus strain was isolated from Wuhan to the time that actually the entire viral sequence, the genome was sequenced, it happened literally within days or weeks. And from there, various people went on to develop diagnostics, kits, vaccines, drugs, and so on. So this would not have been possible without the concerted effort, without the collaboration, the push by the WHO for open sharing, transparency of data. So I think this example that you gave about the 5 nations and the information that they have in the testing, I think it only speaks to this very collaborative approach in a way that the global community has taken to address this epidemic.
Perfect. I think that brings us to a close. All kinds of questions you took. Thanks so much for that, because this has been such a lurking issue, as you mentioned. So from research to quarantining to really the controversial political moves. Hopefully, in the next couple of months, we will see this slow down, and then the normalcy will be restored. Thanks so much, Dr. Gill. You are in New York, very early morning for you. And thanks to all the participants and subscribers of ET Prime to have given time and asked all the pertinent questions. It really brings in a lot of qualitative, discourse around this. And hopefully we'll be able to do a few more around this subject and a few other subjects that we cover very extensively. So thank you so much, and catch up soon. Thank you, Dr. Gill, again.
Thank you, Vikas, for having me. I wish everyone well, and I wish everyone to be safe.
Thank you.